Hey everyone, my name is Dr. Tudin Kathy Nguyen. I am a primary care sports medicine physician with Memorial Hermann Medical Group. I will be speaking with you all about how to play sports safely during the COVID-19 pandemic. I know COVID-19 is a hot topic right now. It is all over the news. It's part of all of our conversations. I wanted to give you some general guidelines and also give you some tips into how we can promote the most safe athletic environment for our athletes. So what is COVID-19? COVID-19 is a novel viral strain, part of the coronavirus family. It can cause a severe acute respiratory syndrome, therefore it's known as SARS-CoV-2. This virus is spread from person to person through respiratory droplets, and people carrying the virus can be asymptomatic, meaning they are not having any symptoms, and they can still spread it when they are asymptomatic. The CDC does not recommend any sport or contact activity during this time so we can reduce the transmission of the virus. So how can we proceed to athletics in this type of landscape? First, I do want to reiterate some general recommendations that the CDC has provided. These are the best practices for our day-to-day practice and our day-to-day living. So first, cleaning and disinfecting frequently touched surfaces is important. This does include exercise activity and sporting equipment. So your shoes, water bottles, sports, and rackets, making sure those are properly disinfected after each use. Also, washing your athletic gear and towels after each use is quite important, because if you are using these items outside of your home, you don't want to bring all those germs back into your home, into your laundry baskets, or wherever you keep your dirty laundry. The next part is hand washing versus glove use. I will say I do promote hand washing over glove use. You should wash your hands for 20 seconds at a time with water and soap. This will allow for you to eliminate the germs, the dirt, the virus that is on your hands before you move into the next environment. Using hand sanitizer that's 60% alcohol or greater can also be helpful, but this does not take away the importance of washing your hands. Gloves are great if you are using it in the necessary setting. Also, if you're using gloves, you have to make sure you are taking off the gloves from one environment to another. So I do not promote wearing your gloves from your home into your car, to the grocery store, to a clinic, to an office, and then going back home. You're just promoting the spread of the germs in all of those environments to a new one. So if you want to use gloves, make sure you are discarding it from one new environment to another and still wash your hands in between. Wearing a face mask has also been a hot topic. I do promote using a face mask or a face covering with cloth because it allows a protective barrier for yourself and for others. So you're not only protecting yourself, you're also protecting others if you are an asymptomatic carrier and you do not know. The mask allows the prevention of the respiratory droplets to spread far away when you are speaking because there is an actual barrier there. I also want to say that using 6 feet of separation is important. We are seeing that respiratory droplets do not spread after 6 feet. Granted, this distance is still being researched, and so the actual distance may change down the line if we see new data, but for now, we're saying 6 feet apart is quite important. And then covering your mouth and your nose when you are coughing or sneezing. This is just a way to reduce the spread of the droplet outwards, and it goes into your own arm. And then staying at home if you are sick. The CDC gave us some general symptoms that patients or people with COVID-19 may have. That includes fever, cough, shortness of breath. There are other symptoms that you may get if you have COVID-19, and I will share that later on in this lecture. However, someone may have COVID-19 and be asymptomatic or not show symptoms for 2 to 14 days. So it's really important to seek out medical care if you feel like you have the virus or that you've been exposed to the virus. So I do think there are some safe measures that need to be in place before we can create an environment that is safe to restart athletics. One is seeing a downward trajectory with infection and cases. What that means is we are seeing a decline of infections on a day-to-day basis in the local community. We do not want to see that slope rise or hospitalizations rise. We want to make sure that that slope has either flattened out and the new cases have started declining. Secondarily, there should be a treatment and preventative plan in place. A treatment plan means that if someone's positive with COVID-19, we know what the best practices are to help them with their symptoms and help them get better. The other part for prevention is possibly a vaccine or possibly the best practices to eliminate the risk for transmission. And I'll go through that with some of my guidelines below. Third is a spread mitigation plan in all athletic departments. What that means is a plan and protocol that is in place to make sure the environment is safe. We have a disinfection protocol, and we have a plan that will be implemented if one of the team members does get infected. So I do want to discuss some levels of risk in activity and sports. I know that our athletes are not playing their regular sports right now, but everybody should still be active. And so what are the risk categories in certain activities that we can do right now? So low risk, medium, and high risk categories will identify what type of activity you can participate in and the location of the activity and the people that you are doing these activities with. So low risk activities would mean individualized athletics or exercise in your own private space, and also those activities with your household members, meaning people you live with and not family members that live in a different dwelling or home. A medium risk setting would mean an individualized exercise or a household activity in a public space that is wide open with plenty of social distancing opportunities, not a crowded route or a crowded hiking trail, but an area that is wide open that you can share. It may also include a saltwater facility or a chlorinated pool facility that has enough space to allow household groups to participate in, but they would have to really have infection control measures in place. A high-risk setting would be any group play or training with non-household members, so members of the community or friends that live in different households, and also not physically distancing yourself in a public space or a route or a trail that you are running or jogging in. So some specific examples would be a low-risk setting would identify indoor cycling at home or home treadmill use, or using your backyard to play sports with your household members. A medium risk activity would be jogging or bike riding outside with your own bicycle or your own equipment in a public space that allows you to have 6 feet of separation with other people. You can also play sports like basketball or football or tennis in a public facility with your household members. A public chlorinated pool or saltwater facility, like I spoke about earlier, could be considered medium risk as long as there are proper disinfection protocols in place and they're allowing social distancing. Now, a high-risk setting would be playing sports on a basketball court or a tennis court or somewhere with non-household members, playing pickup games with people you are not familiar with. Other example would be walking, jogging, or biking on a very crowded route. So if you are side by side, shoulder to shoulder with somebody, you would be in a high risk setting. Use of a public or shared environment without proper disinfection protocol would be high risk, especially if you do not see any disinfectant wipes or sprays around in that area. And then using water parks or pools that do not have proper spacing amongst different groups or proper disinfection protocols. And you should really ask before you go to these facilities what their disinfection protocol is. So I have a checklist of what protocols we should consider once we restart team athletics for the athletic departments, coaches, and also for our athletic trainers to really look into. I do encourage starting with individualized drills for our athletes because they have been out of sport now for 2 to 3 months. Starting individualized drills that are given by their coaches can be important so that they're starting to ramp up their athletic requirements for their sport. Once we start that, you can move into small group setting. Small groups are important prior to starting full team setting because it allows for contact tracing. So if one person in a small group has positive COVID-19 and have been infected because of their environmental exposures, it's much easier to identify who they've been exposed to if they were in a small group versus if they were exposed to the entire team. If one player that is part of a team exercise has been exposed, we have opened up our transmission rate exponentially, and that is a much larger amount of players and staff to have to look into prior to continuing the athletic environment. So also having a safe space for our athletes to practice and train in is important. You have to consider, is this a public space or a private space? And if it is a public space that you want your team to use, making sure that during an official athletic practice, other people in the community are distance away from your group. Because if you are sharing this area with other people, then you're really opening up the doors for transmission by people that are from unknown communities. Something to consider is travel to and from the facility. I do encourage keeping that consistent. I know it might be difficult with certain athletes because of, transportation. Do they have private transportation? Do they need to use the bus? But if you can transport in the same car with the same team members or the same family members, that will really keep the level of possible spread consistent. And when you get to the facility, it's the general same amount of people that have been exposed to each other. Some questions to consider before allowing the athletes to participate would be, have they been in quarantine or self-isolation during this time? Or have they been out and about over their friends' homes with their families in all different homes, or have they been traveling? These parameters are important to know because this allows us to contact trace and to know the risk from each player to another. Another thought is, has the athlete traveled in the past 14 days, or have they had any COVID-19 exposure in the past 14 days? If they have, I would heavily suggest on promoting a 14-day self-isolation before they incorporate themselves back into a team activity. I do say that you should complete a daily symptom checklist and check temperatures daily for any athlete that will be participating in a facility that will have multiple team members in, or once we start into small groups and full team athletics, you should have a daily checklist and temperature check so that we can keep any players that may be positive or infected at home during that day. So a symptom checklist can include these pointers that I have here. So fever, cough, shortness of breath, difficulty breathing, chills, headaches, muscle pain, sore throat, new loss of sense of taste or smell are the most common symptoms we see. We have also noticed some gastrointestinal symptoms like diarrhea, nausea, and vomiting. So I would simply have this as a checklist and have the athletes complete this checklist every day. If they do screen positive for any of these symptoms, I would suggest that that athlete does stay home on that day and seek out medical care by their doctor before they return to participating with the team. Some best practices that an athlete and staff can participate in while we are in this hypothetical return to team setting would be keeping a daily log of people that they have been around or any new exposures that they have been around. This would allow for easy contact tracing. Also, bringing your own equipment to training, and that would include water bottles, towels, spit cups, anything that you would use or that the team would allow and share with you. If you can individualize that, that will really reduce the amount of viral transmission that may be out there. One note is to bring your own towel. So if you are practicing in a public space, usually we get fatigued, we want to sit down, we're sweaty. So I do say bring your own towel, and sitting on your towel on the court, on the bench, on the grass, so that your own droplets do not get spread into this public facility and you are not picking up other people's droplets when you are sitting down. Sanitizing your hands consistently, avoiding touching your face, avoid removing personal clothing and leaving it in public spaces are also best practices. What I mean by that is we tend to layer up, and taking off a jacket or taking off an arm sleeve and throwing it down on the ground would also increase the rate of transmission of the virus if you are a carrier. So if you are doing any of that, making sure you're putting it into your own bag or into your car instead of spreading all of your personal items everywhere. And as I said before, bringing your own spit cup. So if you are prone to spitting onto the ground or onto the field, maybe having your own personal cup and taking it home, then discarding it so it's not in the public can be important, because we know this virus is spread through respiratory droplets. Some items that I do have recommended for you guys before returning to sport or athletics are listed next. So before returning to full sport, I do highly encourage that everyone assesses their own personal fitness level. Like I mentioned before, we have been out of athletics for 2 to 3 months. And without that training, a lot of our athletes can be deconditioned, and returning to athletics is an exciting venture. And so we don't want to go from a minimal activity level to 100% full activity level. We still have to note that there are musculoskeletal injuries, concussions, and other injuries outside of COVID-19 that can occur once we restart athletics. So making sure our own fitness level is assessed before going to play is key. I do encourage that our coaching staff does progress return to play slowly and have a ramp up period. So there may be a condensed preseason before full season, and therefore we have to really take this ramp up protocol seriously, because I know everyone gets excited and we want to go into full sport, but we don't want our athletes to get injured as they are pushing themselves hard whenever they've been in a lower level activity setting. Making sure that you involve yourself with school and league sports is key. But if you're returning back to both school and league activity, this is 2 levels of load on your body. So really assess how much you can truly do, and don't push to 100% just yet. I do encourage that every athlete and every person maintains their immune system. In athletics, it's very rigorous on our body, and so it may put you at an increased risk to getting sick if you're pushing your body too hard. So some tips to maintain your immune system would include really avoiding detrimental things for your body like cigarette smoking, vaping, tobacco use, alcohol use. Anyone underage should not be participating in this anyways, but this is key. Alcohol also decreases your immune system, so please do not drink at this time. Making sure you are maintaining proper hydration with water and electrolyte water if needed. Maintaining a healthy weight is important, and with that, I would encourage regular exercise and looking at those risk factors like I spoke about earlier, about high risk, medium risk, and low risk settings that you can exercise in. Making sure you get proper sleep is so important. Sleeping 7 to 9 hours a night will help promote your immune system and reduces your stress cortisol levels. And eating a diet in high fruits and vegetables will also promote your antioxidants to keep your body's immune system well. There is some evidence that stress reduces our immune system, like I spoke earlier, because stress will increase our cortisol level, which is our stress hormone. So minimize stress by proper mental health is key. And then consider some micronutrients as a supplement like vitamin C, vitamin D, and zinc. Really, as we go forward, some of our athletes may get infected with COVID-19. There are a range of symptoms if one person is infected, so you can be asymptomatic, you can have mild symptoms, and you can have severe symptoms that require hospitalizations. Most of the information out there does say that the younger you are, the less severe symptoms you may have from this infection, but we are seeing cases of some diseases and some conditions that are rare that are being presented in our younger populations. So the aftermath of a positive COVID-19 infection may include symptoms that affect the heart, our blood disorders, coagulation disorders, and then also how does it have long-term impacts on our respiratory system? These are things to consider down the line, and if someone has been positive with COVID-19 or an athlete is positive, I do suggest talking with your primary care physician or a sports medicine physician to discuss how can you progress safely after you've been infected. I do not recommend that you go into full sport right away after being infected because there are a lot of parameters we should monitor to go into full activity. I did want to mention that the UIL did change the recommended guideline for pre-participation physicals for this upcoming year. So if your athlete has already completed a pre-participation examination for the previous year, that physical exam can be rolled over to the 2020-2021 year. However, if they have not completed a physical exam or a sports physical, they do need to get that completed before the new athletic year. So make sure you contact a primary care physician or a physician that can complete sports physicals so that your athlete meets that check mark before they start athletics. So, overall, can we start playing sports safely? I think yes, we can. I do think there are a lot of parameters that we have to work towards before we can go back into what we know as our norm with team activity. However, this is a new climate for us. We can participate in sports and we can participate in activity, but there are guidelines that we should consider, and we have to be flexible. Things are ever changing, and I know that we can make this work, especially for our athletes, because sports is important. We know that this is something that really helps with mental health, with physical activity, and it does change the lives of a lot of our athletes. So I encourage you to stay positive. I encourage you to stay updated on the news and recommendations and to practice the best practices going forward. Thank you.